Okay, so now, this is sharing my screen. So welcome back, everyone. This is going to be our next lecture video or next episode on Ask Ren's MPH. And as you can remember, in our last video, we talked about an introduction to global health. In this video now, we're going to be talking about why do people choose global health? And really, we're going to be touching upon the need. What's the need in global health? We're also going to talk about my own personal journey and the reality of global health work. So sit back, relax, and enjoy this recording. So there's really a great need in global health. Millions lack access to basic health care, whether it's needs like nutrition. Um, and this is not just a problem in the Philippines. This is a problem all over the world. And as you can remember in our last video, we talked about what equity is, what is health inequity, and how does this affect people, especially in low and middle income countries? And as we've seen, there are many challenges in low and middle income countries. And that's the reason why health inequities continue to persist. So, an example of this we can think about is infectious diseases like tuberculosis, malaria, and HIV. A more relatable example is the COVID-19 pandemic caused by the SARS-CoV-2 virus. We've seen how this has impacted our own countries. We may be living in a more developed country like Canada or the United States, but those who've experienced it in low and middle income countries, they can say that, it's taken really a huge burden on their health system and on the country as a whole. We've seen a lot of these deaths that have been attributed, for example, in the COVID-19 pandemic, a lot of the deaths came from low and middle income countries, those with health systems that may not be as advanced or developed. And so we can see how these people are disproportionately affected. This is also the same for non-communicable diseases, like diabetes, hypertension, um, heart disease. However, wealthy countries or developed countries, they're not immune to non-communicable diseases. The United States and Canada, they have their fair share of diseases and fatalities related to heart disease, and as well as countries that may not be as developed like the Philippines. So global health really looks at the global perspective, more on the planetary scale. And finally, we can talk about child and maternal health disparities. So this is really the focus on global health improvements and interventions, because the maternal health or the health of the mother really predicts the health of the child. And so we can see a lot of mortalities, a lot of premature babies that are born result from the mother being unhealthy, not having proper nutrition. And so both of these things are connected. And this is really the focus for those in low and middle income countries. There's also a lot of infrastructure gaps with the health system. So there's a lot of places in the world where the health system is not as developed. It doesn't have the same amount of capacities that more developed systems have. Um, there may be a lack of workforce in healthcare, or there may be other factors, other structural factors that contribute to a poor health infrastructure. So, an example would be the political situation in the country. That can sometimes lead to the deterioration of the health infrastructure. Okay. Now I'm going to talk about the global health crisis in the Philippines. So, here there's a high rate of poverty, and having this high rate of poverty, you can just see the downstream effects on the health outcomes. As we've discussed in the previous slide, that can be um, poor maternal health, poor child health, poor nutrition, and this is really a wide scale problem. There could also be limited healthcare access in rural areas, undernutrition, and food insecurity. And so you can just see how this, again, affects those at the very bottom of the socioeconomic ladder. There's this picture below. This is actually taken in, I believe this may be in Tondo, Manila. I'm not quite sure, but you can see just the juxtaposition of these two perspectives living in this form of informal settlement, um, these slums, as you would call it. And you can see those high rise buildings at the very back of the background. They're just towering over. And this can really be a testament to the large gap between the rich and the poor. And this is extremely evident when you come to the Philippines and you just see two perspectives. You can be in one area of the city, like BGC or Bonifacio Global City, or maybe Ortigas Center, and you can imagine yourself in, a central business district. But just driving 30 to 40 minutes, you can see just the complete opposite of experiences experienced or felt by people at the very bottom of this of the country. And so, to a global health researcher, or even just a person who is very interested in global health and improving the lives of those around the world, this is a problem, right? Why do people have limited healthcare access, especially in these areas that, maybe in a more rural area of the country? Why do we have undernutrition? Why do we have food insecurity? In other words, why are people not able to access the same healthy food options as those on the top of the socioeconomic ladder, those who are more wealthy? And then we can just bring this last point about climate change. And how does this worsen health vulnerabilities? When we think about the Philippines, it experiences a lot of typhoons, floods, and sometimes even earthquakes and volcanic eruptions throughout the year. And you can see how being in the Philippines and being, at the very bottom, experiencing all of these poor health outcomes, facing extreme poverty, your life is made um, much tougher because of all of these climate change events and extreme weather events. And so, how do we solve this, right? And it's not just one size fits all approach that we need. There's a lot of factors that we need to address when it comes to addressing all of these problems. And for me, there's really a personal connection to global health. Although my family uh, had moved from the Philippines in 2006, we had migrated to Canada. I've lived most of my time in Canada, so I haven't really spent a large chunk of my life here in the Philippines. And so you can say I'm maybe not that cultured, but seeing the first-hand impact of poverty, even just watching, the news, looking at documentaries, um, I can see there's really a great need for this work here. And so again, it's for me, a calling to serve communities in need. Even though a lot of people were really against me making this move and actually doing work here, um, I still felt called to actually make this impact, to actually contribute my understanding, my international experience, and my world-class education to actually help those in need, those who may not have any voice at all. And so why do people choose global health? So I've talked briefly about my own personal experience. And in the future, I'll talk more about the specific projects I'm involved with currently, maybe some projects I've done in the past, and how this has shaped my understanding about global health. Um, I'll talk about that in a future video, but I'm just going to generally talk about why people choose global health in the first place. So really the first point, I'm sure you guys are all confident about what equity means now and what justice is. Justice is really connected to equity, which means that everyone is given a just opportunity, a fair opportunity for all of these health systems or health services, that everyone has that same opportunity to receive those. And so, again, this stems from a passion for equity and justice in health and healthcare. There's also this desire to make a real world impact. You know, how many people can say they've actually made an impact to the lives of people around the world or maybe in a community? You know, not too many people can say that, right? Um, you know, you can be a teacher, you can make an impact in the classroom, um, you can be a psychologist and then make an impact on the life of a couple of individuals, you know, in your office. But global health is really something where I'm not saying those careers aren't respectable, but I'm just saying this is the difference with global health. We're actually making a real world impact, and it's at a global and international scale. There's also a lot of opportunities for interdisciplinary and collaborative work. So there's a lot of global health researchers right now. There's a lot of health equity researchers, planetary health scientists who are doing work on climate change and extreme weather events. So there's a lot of opportunities for collaboration and work within different disciplines. So, you know, you can really bridge all of these disciplines within global health. You know, global health, again, when I had showed you a picture, a little diagram in the last video, just with all of the networks that are related to global health, all of the different disciplines like health studies, you can actually use all of these disciplines in your work and in your research. So, again, for me, if you remember, part of my training is in global health. So it takes more of a biomedical approach. And then the other part is health studies. So that takes more of an interdisciplinary approach. So again, bringing the disciplines of psychology, for instance, anthropology, sociology, and you're bringing that into health. And that's what health studies is. And so, you know, you can't really say that global health is one discipline. It's a combination of many disciplines that contribute to health research or health work. Um, and so there's all of these opportunities, you know, there's really the sky's the limit. And then fourth, a lot of people choose global health because they're interested in diverse cultures and health systems. So again, we can just think about where we are right now. Your health system might be set up differently, right? Here in the Philippines, there is a Universal Healthcare Act. And in Canada, there's also socialized medicine and healthcare. So you don't really pay for a lot of those services when you go to the emergency room. And that's also a different story when you go just south of Canada in the United States, where healthcare is a commodity, right? Where you actually have to pay for services. Nothing is free. And so, you know, you might have this interest in actually um, health systems, but also in the diversity of cultures, right? You know, you can just think about your own personal journey. What is your ethnicity? What is your background? Did you also make that same journey as I did with my family and migrating? And you might have this interest of actually contributing to your own country, right? So there's a lot of diversity. There's a lot of cultures that are, there's a lot of interplay, I would say, between cultures health and health systems, right? There's a lot of cultures that have different beliefs about what healthcare is, what health is, right? Just this basic unit of health and how medical treatments are, or how medical treatments should look like, right? So different cultures, different communities have perspectives about what the proper healthcare is, right? So I think you need to have a deeper understanding of culture as well when you're talking about health. And finally, there's also a sense of responsibility for those who choose global health as a career. This sense of responsibility really stems from the idea to actually help those who are underserved, those who may be in the, again, at the very bottom of the socioeconomic ladder, those who may not have a voice, those who may not be seen. And so, you might have this passion, this responsibility. You might feel it inside. It might be because of your values. It might be because of your culture. It might be because of your faith or your religion, or it can just maybe be, this intrinsic motivation inside of you to actually make an impact for those in need and to help the underserved. Or it can be a combination of all those things. And so, there's really a lot of reasons why people choose global health. It's not just one thing. You may hear 100 different answers from the people you talk to or the people you connect with that may be in this field already. Okay. All right. But let me tell you what the truth is. What is the reality here? You know, People sometimes don't go into global health for the money. Again, when we talked about why people go into global health, it's about passion, it's about the actual drive to make a difference, to help those in need. So sometimes it's not really about the money. And that can be something discouraging for people who want to make a lot of money, right? And I think that for me, I have to admit to you that's something I wanted to have, just starting in global health. Even though I'm doing global health research right now, I'm doing my master's, I'm right now, it doesn't feel like I'm doing it for the money, right? Because I'm working in a low and middle income country. I'm not being paid what would be the minimum wage in Canada, for example, right? So I'm adjusting and I'm adjusting to a different standard of lifestyle, not the same that I've been used to, right? Living in a more developed country. But for me, it's essential to go through this, these hardships, these trials, right? Because it will pay off in the end. And so this is just a word of encouragement for those who might be working in a different country, might be doing an internship where they're paid, very, very small fraction of what they'd be paid if they were working at McDonald's, for instance, in the United States or Canada. But really, we don't do this right now for money. This is really not the goal. Of course, we need to have and make a living, put a roof over our heads, provide for our families, but really, this is a passion that, you really have to decide for yourself if you're up for it, if you want to do it, if money is not the only thing that you'd want in your career, right? So many global health professionals work in, again, low and middle income country settings. So a lot of the times, like these jobs actually pay less in clinical or private sector roles, especially if you're working for an NGO, right? A non-governmental organization. For example, I had worked for an NGO, and so a lot of our funding for research projects came from donors around the world. And so when the company is relying on, a lot of donations, that's when a lot of the times they can't ensure that you have a full bank amount or a full bank balance for all of the employees, because that's not what the goal of NGOs are, right? It's not to make all of their employees rich. Their system is about making deliverable impacts to those in need. And so the need is actually for the greater whole, the common goal is for all of society to have good health outcomes, right? So, and again, this is at the expense of those who are working. So that's why we see these jobs, especially in the non-governmental organization sector, the development sector, they pay less. So that's something you just have to accept. If you're like, no, I need to have the money, or if you're like, I can't live without a six-figure income, then maybe you have to decide for yourself that maybe this is not the job for you, right? So maybe you need to explore a different career, right? Because I'm telling you the truth. This is the way it is, right? But people do it again, like we've talked about in the previous slide, because they believe health is a human right for everyone. Doesn't matter how rich you are, it doesn't matter if you're living in a slum or living in a condo, health is a human right for all. And so, again, bridging the concept that we learned about equity, we need to ensure equity that everyone gets the same supports that they need, the exact amount of supports, not more, not less. So just so they are equally served and just so there is justice, right? Social justice. So a lot of people are passionate about service and social justice, especially for the poor. And then they also see long-term impact of their work. And again, going back to the example of what global health researchers are, what global health workers are. They see the long-term impact of their work. They see it maybe not right away, but maybe in 10 years, 20 years, 30 years, they'll see the impact of their work. And so that in itself is very fulfilling. It's rewarding, right? You know, and we can use this example. If you're a teacher, you can say, I'm doing good work. I've seen how my students are improving, how they've improved over the years, and I'm proud. I'm fulfilled, and that's great. But and to compare that with a global health professional, we're looking at population level. So what is the long-term impact of our work? And that's what is fulfilling for us, knowing that, in this specific period of time, we contributed to this project. We published this research, and, maybe in 2 years, it doesn't make any impact at all, but maybe after 5 or 10 years, it actually improves the lives of those in need, right? So that's really the impact of our work. And that's what we believe is very rewarding and very fulfilling. And, I like to just state this quote here. It's a quote I've heard throughout, my whole educational career back in high school. A person who loves his or her job, never worked a single day of his or her life. This is really true. If you really love what you're doing, if you're really passionate about it, if you would wake up in the morning at around 4 a.m. just to do this work, no complaints, um, then this is not, a job. This is not a job that you regret doing. It's your passion. It's not a job. It's not a task. It's not a chore. It's your passion. And there are many challenges and rewards in global health, right? You may think in the next slide, maybe I've lost a few viewers just because, I talked about not having enough money in this industry. Maybe I lost a lot of people, but there are certainly a lot of challenges and rewards in global health. Don't worry. Again, maybe let's start with the challenges. So there's a lot of limited funding and resources, as I've already mentioned. But you may also be working in a very challenging and high-paced environment. Your work being a global health researcher or being a global health volunteer, let's say for the US Peace Corps, for example, it might bring you to challenging environments, environments that you may have never experienced in your lifetime. So that can really take a lot of adjustment already, right? But you may be put in these situations that might be uncomfortable or may seem uncomfortable at first. So that's something you have to think about. Are you willing to, maybe reduce the amount of things that you have, essentially downgrade your lifestyle? Maybe if you're living in a high developed country, a lot of these things that sometimes we take for granted, they may not be available in the country or in the setting that you're going to. So you need to keep that in mind. Um, there's also the challenge of policy changes and bureaucracy. And what do I mean by bureaucracy? Sometimes there's a lot of bureaucrats. So it's really essentially a government system where, a lot of changes occur very slowly in terms of policy. So, if we're trying to enact a policy on smoking, for example, just simply, a lot of bureaucracy can happen where, your policy doesn't go through. It doesn't even make its way throughout the end of the approval process just because there's something blocking it. And so that's really what bureaucracy is, simply. Um, a lot of things that get in the way, obstacles that block a policy, in this case, a health policy from being enacted or even being changed, right? We can have an existing health policy that maybe people want to change, right? So, um, and it might be slow, it might also be impossible just because of bureaucracy. So that's the challenge. Now let's talk about rewards. So again, we're changing the lives of communities, right? Individual lives and at the community level. And we see these impacts, right? We see them. Sometimes we see them immediately, right? Might not take 2 years, might take months for us to see these impacts, these positive health outcomes. And so that's a good reward when we're helping those who are in need, who might not have the same opportunities, the same resources that we have. And that's great. But again, gaining this sense of cultural humility as well as a global perspective is also one of the rewards. And so you might be living in a country where the culture is different, the religion is different, the beliefs are different, the ideologies and values are different, but that can actually humble you. Learning about different perspectives, learning to keep your ears open, your eyes open, having an open heart for those in need, that can give you humility. And it's quite priceless being in this global perspective, and that actually allows yourself to be open to many perspectives. So when you're doing research, when you're giving a presentation about global health, you actually have a lot of perspectives in mind. It helps you answer questions, but also understand someone who may be of the similar point of view. And finally, global health allows us to advocate for policies that make a real impact. So again, advocacy is also important. It's a way for, essentially being actively involved in policy change, in voicing out your concerns. What do you believe is right? What do you believe should change? And that's actually what makes a real impact when we're advocating as researchers, as global health professionals for policy change, because this is what ultimately improves the lives of those in need or most vulnerable. All right. So, how can you get involved? So, you might be a student. So, you might be in high school, you might be second year of your university, you might be already in a different field, right? Working. But you can get involved, in the simplest of ways. Maybe you can take a public health course or study a public health concentration or a certificate program just to be opened into this whole perspective. A global public health program. And but you could also study other disciplines that relate to health. Again, health studies, which bridges the social sciences with health, right? Because we normally take many people would assume that we normally take a biomedical approach in global health or in public health. But sometimes we actually need to bring and bridge all of these different disciplines within the social sciences to actually understand health as a whole, holistically. And we'll talk about that in a future video. But simply put, you can study public health. You can enroll in a program if you're interested in. Maybe you didn't pursue public health during your undergraduate degree. You can now pursue it during your master's. Take a master's of public health, for instance. You can also volunteer, do an internship with a lot of global health organizations. There's a very, very large list. Do your research, maybe go on LinkedIn, check a lot of these opportunities that are available for you. You can intern, you can volunteer. And so that's what you have to keep in mind. Is this something you can manage with your current workload, your situation, right? There's also one thing I can suggest to you in terms of a global health program is CFHI's program. So it's Child Family Health International. You can type in CFHI Global Health Program. I'm not in any way being paid or sponsored by CFHI. I hope they do, but that's just one global health program I know about. It's actually one that I want to do is global health in the Philippines. So that's offered with CFHI, Child Family Health International. So they're an NGO. You could also support global health initiatives, whether that's resharing posts, simply, or joining groups, advocacy groups, talking with your peers, your networks. Maybe you can establish a global health group within your high school, right? So you can talk about all of these global health initiatives, and maybe you can do a lot of fundraising. You could also consider a career in research, policy work. So again, remember when we talked about how global health really transcends basic research or basic biomedical sciences and actually transcends into policy work, research work. So you can actually do that. And you can consider working abroad if that's an option available to you right now. And again, this is really in line with supporting global health initiatives is donating and advocating for global health programs. There are many global health programs out there, and if you are in a financially sound position and you're able to donate maybe a few bucks, doesn't have to be a lot. If you can donate for global health programs or even to organizations like the World Health Organization right now, they're doing a lot of collecting of donations just from normal individuals like you um, for their global health programs right now. Because again, you might have heard in the news a lot of funding cuts from the US, for instance, backing out of World Health Organization. So they're doing a lot of fundraising for that. If you can donate, maybe if it's just $10 a month, that would really make a great impact for the lives of those in need, children, elderly, adults, everyone, pregnant mothers. A lot of people really need your support. And it doesn't have to be a lot again. Let me reiterate that. It doesn't have to be a lot. $10 a month, that's like two Starbucks coffees. I'm sure you guys can do that. And so again, I chose global health really because of my connection to the Philippines. That's where my family is from. I'm Filipino. You don't have to know a lot about your country, where you came from. Just having that passion, that want, that desire to actually contribute to global health, that's enough, right? I don't have a lot of experience living in the Philippines, but yet I managed to move here. I managed to adapt, and so far it's been a very pleasant experience. And I really like to emphasize that my mission is really to contribute to health equity. I want everyone in the world to have that same impact, or that same impact of global health resources, global health systems that we have in more developed countries. I want them to be impacted by this as well in low and middle income countries. So, health equity, ensuring that everyone has the same supports that they need. Um, Global health, again, I can't stress this enough. It isn't just a career, it's a lifelong commitment. Global health is something, it's not for everyone, but it's something that will change your life. It will make you think in a different way. It will it will open your heart. It will actually make your heart even larger. It will make you more humble. So I really urge everyone to just take a time to reflect. What are their values? What are their goals in life? Where do they see themselves in 5, 10, 15, or 20 years? This could be a part of it, right? And again, you don't have to be a doctor, a medical doctor to make an impact. Just being a researcher, being a health educator, a volunteer, you're already making an impact. Good job for that, right? We don't have to be making six figures to make an impact, right? This is a very respectable job to do on global health. And again, it's not for everyone. And so that wraps up my talk today. And I thank you once again for listening and stay tuned for the next episodes. I'm hoping that you really learned a lot from this lecture, and I really hope that I've motivated you maybe in some way to actually pursue a career in global health. That's all for me now. Thank you for joining me at Ask Renz MPH. Take care.